Nothing in this podcast or on our website should be construed as medical advice. Consult your healthcare provider for your individual nutritional and medical needs. The information presented is based on our research and is strictly that of the author and not necessarily those of any professional group or other individual.
Hi, I'm Sue Becker from Bread Beckers. Welcome to Sue's Healthy Minutes. I'm so excited you've joined me today, and I hope this episode encourages you and allows you to find the answers you have been praying for the health of you and your family. Today on Sue's Healthy Minutes, I have my very special friend and guest, Dr. Rebecca Edwards of Grove Dentistry in Oxford, Mississippi. She focuses on biological dentistry and emphasizes a holistic approach to dental care. And we're going to hear all about what that is. So don't worry if you didn't understand any of that. She loves to talk about oral health and how it affects the whole body, which again, she's going to share all that with us today. Dr. Edwards is the co-founder of the Need Your Cure. It's an annual faith-based health and wellness conference, and she is the host of her own podcast, The Tea on Teeth, and I can't wait to hear about that. But I first met Dr. Edwards at the Need Your Cure conference in Oxford 2 years ago. I can't believe it's been that long, and I'm so excited that I'll be joining y'all all again this year on August 14th and 15th, along with Rebecca and a host of other amazing speakers. And if you haven't registered yet, I encourage you to do so. And I'll put a link to the registration in the podcast notes today. Rebecca and several others heard about the amazing benefits of milling your own grain and started on this journey, and I think started a bread revolution in Oxford. And even that's kind of what led y'all to starting the Need Your Cure conference. And then you even have a Bread Beckers co-op going on there. So it's just a privilege to have you here with me today and to be able to talk to you. Thank you for joining me. I know you're a busy, busy lady, but so before we jump into all things dentistry, tell us a little bit about yourself, your background, and your family.
Thank you so much for having me. I'm just so joyed that I'm on this podcast. But I have been a dentist for over 30 years, and I was a traditional dentist for 23 of those years. And then now I'm a holistic biological dentist that really makes sense with all the things. You know, we question the bread, we might as well question everything else. And this works perfectly. I have a son and a daughter who are older, and I have 2 grandchildren, husband, and everything. So, yeah, all the things. And then,
all the things.
Yep.
Wow, that's amazing, Rebecca. So, okay, before we jump into dentistry, I have to ask you, how did you first hear about milling your own grain and making your own bread? And like I said, y'all started a revolution there. It's crazy.
Well, actually, it was one of our co-founders for Need Your Cure. They came to me, and I was like, really? You're milling your own bread and all this? And I was like, well, I've always questioned about the bread thing.
Yeah.
And then they told me, and I'm like, well, I've got to do it, of course. And I was like, my patients need this. So, yeah, that's where we started. And then they were going to have you, I think, here for a small little church, 25.
Oh, yeah.
And I was like, well, let's just have everybody in a big conference. I'm always the big dreamer and everything of the group.
Well, everybody needs one of those. So, well, I remember when you first reached out to me, it was like, can you just come speak to our little church? And then the next thing I know, it was like, okay, this is bigger than we thought. So, and it's just grown every year. So y'all created quite a stir there in Oxford for sure. So, so tell us a little bit, what led you to dentistry? Why dentistry growing up?
Just what I wanted to do when I was little. So just continue that. God placed that in my little soul at an early age. And I played dentist as a kid and all that. And I went to school and just went straight for it. So that's one of those things. If I want to do something, I'm going to figure out how to get it
How
done.
to do it. Yeah. That's so funny. I just hadn't remembered this until just now. I remember one of my sisters, I guess, got braces and had a mold of her teeth, a plaster mold. And I used to play dentist too. It was kind of fun.
Fun.
Yeah. People are like, you played dentist? Yes, we did. But I didn't go into dentistry like you did. So give us a little explanation of the difference in, say, traditional dentistry and a more biological approach. And how did you make that transition?
Okay, so traditional dentistry is going to mainly be symptoms. So I look at, and biologically, we look at tooth decay, gum disease, needing braces as all of symptoms. Whereas traditional will just be a symptom manager, kind of like in medicine.
Yeah.
And I had questions and all throughout, especially with mercury and fluoride. I knew that there was more to just your body than just slapping fluoride on your teeth and saying your cavities are because you don't brush your teeth,
Yeah.
And then mercury filling never made any sense. That if you break a thermometer, it was like, clear the room, don't touch it, it's very dangerous. And then we're taking the same amount and putting it in your mouth.
Yeah.
Never
Something's wrong with this picture. Yeah.
Yeah. And I'm a questioner, so that made more sense when I learned all the things that were kind of hidden knowledge because they weren't taught to you in dental school.
Yeah.
And when I found my people, it was like, oh, yay.
Okay. I can do this. Yes. Okay. So anybody with a more health conscious mind and doing some research, especially trying to get to the root causes of illness and health issues, they're going to hear about root canals, mercury fillings, and all of these things. So how does all of this how does our oral health truly affect the overall health of our whole body? Yeah.
So the teeth are organs in a bone. And so that's what's unique to the whole jaws in particular, because we have an organ that's in that jawbone. And then how that organ can mess with anything else. So like gum disease, that gives us that's just a symptom of maybe a malnutrition from not having enough vitamin C, or it could be your microbiome being out of balance.
Yeah.
Most of the time it's malnutrition, in the standard American diet. And then the influence of toxins and everything affects how your body is taking in nutrition, if you are really nourishing your body the correct way. Yeah. And we look at the Weston Price Foundation and Dr. Weston Price work.
Oh, yeah. Yeah. Mm-hmm. Yeah. So that's fascinating. I never thought about the teeth being an organ connected to a bone. I mean, that's pretty significant. Mm-hmm. Yeah. And I guess I've never thought about dental problems just being a symptom like other symptoms that go on with other health issues. We never just really think about it. We just think about, oh, my teeth are rotting or whatever.
Right.
I guess. Yeah. So what are some of the issues you see when treating someone, and what are some of the health issues that you see that are related? And I just thought of this. Have you ever mapped like a specific tooth to a specific health issue? Have you ever done that?
Yeah. So in all of my little treatment rooms is a meridian chart. And so a lot of hot topics right now are women's health and breast cancer in particular. And they're looking at allopathic, won't see it, but in alternative medicine, functional dental, we will see, okay, you've got breast cancer in the left breast. Well, then you would come to my office and I would look in your mouth and see what tooth is on that meridian chart is related. So it's usually an upper molar or a lower molar. And then we'll go and say, did you have a root canal or is there a bad tooth there? 9 times out of 10, we can see that there's a tooth that has an issue.
Wow.
And what happens is that infection is constantly, it can't drain, it's draining in this lymph node.
Yeah.
And so when they did these tumors, there's some research where they took the tumor, looked at it, and what pathogens they found were actually in the mouth. So they were mouth pathogens. in the breast tissue that was in question. So that's how they kind of connected it. Well, if you look at the meridian chart in Chinese medicine, we notice that that energy is on that same meridian. Yeah.
That is fascinating. That is fascinating. So some testimonies. Do you have, I'm sure you have stories because you've been at this for quite a while.
Yeah. And so the funny thing to kind of tie us in, and when I learned about bread, and your poop story. So we know everybody. Susan's always got her poop story.
Yeah. Well, and I'm going to say, I have It's the Bread story. So you're going to have It's the Teeth story. So there you have it.
So a patient will come in, like one of them, they have mercury, and mercury needs to be taken out safely because you know, it can be more toxic if you don't do it in the correct manner. But that patient also has to be pooping correctly.
Yes.
So daily. And so I'll have that conversation. Well, what does it look like? And we'll have the Bristol stool chart. And then we'll have, is it daily? And then some of them will go, no. And I'm like, well, let me turn you on to bread. It will be, they go, well, I'm gluten-free, because that same patient is usually on the gluten-free and hasn't had any bread. And I'm like, well, let's just start with it's in the Bible, so we should be able to have it. And then I'll do a brief, it's the bread, and do your, and then I send them directly to your website, and I'm like, you've got to do it. And meanwhile, in their mind, they're going, a meal? I can't mill my own bread, And I'm thinking, you're thinking the same thing I did. It's some big stone that goes around and mills.
You have to have a barn and animals. And,
and I gotta have cows and horses and everything like that. And they learn about that, their life has changed. And I get them on the bowel movements daily at least, and then they're better. And then another story that you had was with the children and your tonsils. And I see children with airway issues and tonsils. So me and a parent will also bring in the freshly milled grains on that. And it's been a huge impact on my practice to have your knowledge shared with a lot of people, because they're freeing. They've made their children maybe gluten-free, and because a lot of my patients are really on a really good health journey. Yeah. But they didn't know about the bread, It's just life-changing on them.
Yes, it is. And those of you that are listening that are like, what is she talking about? Tonsils. So tonsils are your little immune system when a baby is first born. And as your immune system gets stronger and stronger, the tonsils should actually atrophy and not be needed. So they'll shrivel up and be very small. And we're not seeing that in America. You're seeing kids with swollen lymph nodes, swollen tonsils, and it is causing issues. So, and you're like, how does bread fix that? Because it strengthens your immune system. Mm-hmm. And I think another thing, people don't understand that those bowel movements, constipation is not just an uncomfortable situation. That is your detoxification, is elimination through the bowels. And I
can tell that with bad breath. So if a patient comes in with a complaint of, somebody's telling me my breath, I was like, well, your breath stinks. A lot of times, yes, it could be malnutrition, but it could also be your pathways aren't open for detoxification because you're not. And then we'll have another bowel movement.
I'm so glad. I've made such an effect on people.
I mean, it's truly, I remember when I was a little girl, my aunt would used to say, well, has she had her bowel, and that was used to be a common back. Daily, your grandmother would ask you, or somebody, a female, would make sure that would happen every day. And we've kind of left that aside and don't talk about it, but it really is fundamental of our daily life. If you are not doing that daily, we've got a primary issue.
Right. And I guess, I've never made the connection with teeth health. And so this is quite interesting. All right. So when people want to go a more biological approach, what are some dental treatments and cautions that we need to consider? I know I called you one day because they were talking about root canal. Thank you for answering my call. Thankfully, I didn't need it. They were like, nope, you're fine. So like, hallelujah.
Yeah.
So, we get that a lot. And I think, there is information out there to scare us all from root canals and implants and things like that. So can you address some of that? What are some things we need to be cautious for, and what's a more alternative route maybe, or answer?
Yeah. So let's just talk about root canals in general. Sometimes they're good, and I'm not saying good. They're just, everything in medicine is got that 5-year thing. I don't know if you've ever listened to doctors or anything like that, but even in dentistry, like a crown only can last 5 years according to insurance and everything else.
Yeah.
And then a root canal, the life expectancy is success. Anything over 5 years is the thing. Nothing is permanent. And then so in children, we can't do implants to replace a tooth. So if a child had to have has a deep decay, they would go in and say they might need a root canal. That would be a good indication to hold that tooth space until they could have an implant at like in their 20s. It's not recommended for anybody under the age of 18. So that would be a good time to maybe have that discussion. Or if you're in severe pain and you've got to have something and you need to you might want to go ahead and with a root canal, but knowing that in the future you're going to have to lose that tooth. But it is a potential for infection, and it needs to be a discussion of it's a dead organ inside the tooth. So consider like you getting your gallbladder out.
Yeah, I was just thinking that.
But they can't do taxidermy on your gallbladder. And leave it in there like, oh, okay, we're just going to feel it. We're going to take out the gross stuff and clean it out really good and stuff it back in you. That doesn't happen. So think of that. If that's an organ, just like a tooth is an organ. So when that dead organ is still in jawbone, that's still a living tissue, that's where the potential problem exists. And we can't, even the best endodontist right now still cannot get all of those areas clean in that tooth enough from the pathogens to make it healthy. And you can't revive it. I mean, dead is dead.
Yeah.
The body still will have an immune response to that dead tooth on that meridian.
Interesting. Yeah. That gallbladder was exactly what I was thinking of. We all want to avoid surgery, but sometimes it's not avoidable, right. Where you're at. So, wow. I wish we could all come to Oxford and have you as our dentist, but what can someone do to correct some of these issues and find healing? And we can't all come to Oxford and have you as our dentist. So what are options for us? What can we do? What can we question? What are good questions to ask the dentist that we're going to?
Ooh, because a lot of them still don't see what I see.
Yeah.
But always ask for informed consent. So inform yourself more than anything. Question everything. And if that dentist does not want to sit down and have a conversation with you on the pros and cons, how it'll affect my health, and it will, everything affects everything.
Yeah.
Then I would choose somebody else.
Yeah. And if they say it won't affect your health, there's no side effects, you're going, okay, I better,
right.
I better rethink.
That'd be a red flag. And they can, the top 5, your nutrition, sunlight, grounding, the peace pillar, big time. Asking the Lord, say, okay, what would you want me to do? And wait and listen. And that's where it comes into our Need Your Cure conference. But we had that discussion even here at my office. But that's a big one. And they can go to a couple of websites. The IABDM has dentists just like me. They have a directory, and then the IAOMT, and I'll give those to you for your show.
Okay.
Those two organizations would be a great resource for patients to go to and say, oh, I want a dentist in my area that's like her. Yeah. And we're all over the United States.
Wow, that would be really great. So you just launched your own podcast, Tea on Teeth. Okay, I got to find why the name. I've watched a few episodes, and you're always drinking tea. So
I have my tea.
Yeah, I brewed me a cup for our podcast.
So that was my daughter coming up with it, and she's like, people have got to know more information. And so the tea is like spilling the tea and talking about real conversations on oral health and how it relates to whole body health. So we have all different kinds of topics, and we'll have you on there.
Yeah.
So
I'm excited. I'm so very excited. So where can people listen?
On Spotify or YouTube.
Okay. All right. Okay, Rebecca. So are there any closing words of encouragement that you might want to leave our listeners with today?
Seek first the kingdom of God, and then all these things will be added.
Amen. That is powerful. I think we forget that I've been really meditating on this. We have a listening God. And that's very different from a lot of other religions, if you want to say that. But we also have a speaking God, and he speaks and he talks and he promises that if you lack wisdom and ask for it, he will give it to you. And so that is so powerful. Yeah. And I always say, why do you even want to be healthy? Well, we want to be healthy so we can glorify God and be about his business. Yeah.
Right.
Yeah.
We have a number of years that we are given on this earth.
Yes.
But I want them, and I'm sure you do as well, I want them to be fulfilled in the manner that God intended.
Yeah.
And I think that there's so many things trying to destroy that and bring us to where we're not healthy, that we can't accomplish the mission that we were intended to accomplish.
Yeah, exactly. So I just we were going to close, but I just thought of another question. So genetics, does that have a play much in people's teeth? Do you see that? Like, I inherited just really soft teeth, or is it really more nutrition and diet?
Yeah, we inherit nutritional, the way, I eat the way that my mom ate and all that. So we have genetics, and then we have epigenetics. And so on top of that, it's like how we can do. So we can always change and make our generations better than what we were.
Yes.
And that is through learning. And we've lost a lot of those practices. And that's where the Weston Price Foundation comes in.
Yeah.
With his work. So I encourage people to go to the Weston Price Foundation and learn about Dr. Price's work.
And I love, of course, I love studying genetics and you hear people say, I have this, it's genetic. But then I love Dr. Ben Edwards, no relation. I love his take on it. Something turns those genes on. And if something turns them on, something can turn them off. And good nutrition, healing from the Lord, all these things can turn those genes off that we don't want to be manifested. So, oh my goodness, thank you so much for joining me today. I'm so glad I met you, that I've gotten to know you. Can't wait to see you in just a couple of months. Yeah. It'll be here before we know it. You are just like a breath of fresh air in an often, I think, misunderstood and sometimes frightening world of dentistry. I know people that are terrified to go to the dentist. So, yeah, I just thank you for that. And I love that you love the Lord, and that's your first jumping off place, is to seek him for wisdom. So I want to thank you for joining me. Thank you all for listening. Oh, yeah. Thank you for sharing. Until next time, this is Sue Becker from Bread Beckers with Sue's Healthy Minutes.
Sue's Healthy Minutes podcast has been a presentation by the Bread Beckers Incorporated, located in Woodstock, Georgia. For more information, store hours, and learning opportunities, visit breadbeckers.com and follow us on Facebook and Instagram. Make sure to subscribe to this podcast and never miss an episode. Share this with 2 friends who would benefit from this information, and be sure to join us again next week for more of Sue's Healthy Minutes.